Hello, 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 and welcome to another episode of Wellness Wednesday with Dr. Latoya Wells. I am Dr. Latoya Wells, Doctor of Nursing Practice, family nurse practitioner, owner of Wells Legacy Health and Wellness. Welcome to another episode of Wellness Wednesday. I'm so excited to be here with you all tonight as we continue our discussion on heart disease and Heart Health Month and the importance of monitoring, keeping track of, making sure you know your numbers, making sure you know the signs and symptoms, things of that nature. So welcome to Wellness Wednesday. Tonight we're going to shift a little bit. We're still talking about heart disease, but I want to talk about a population that we don't really talk about as often. And this is the young adults and adolescents. Young hearts matter. It's so important that we talk about and we educate on heart disease in the young adult and adolescent population. Preventing heart disease in the young adult and teen is so important because we see a lot of sudden cardiac death. We see a lot of undiagnosed hypertension. We see a lot of coronary artery disease in the younger populations, more so now than ever. And it has a lot to do with environmental factors, genetics, hereditary, foods that we're eating, sedentary lifestyle, and then things that they're putting into their bodies. So we're going to jump into that and talk tonight. I do have some notes, so if you see me looking down, it's just me kind of looking over my notes to ensure that I'm staying on topic, because I tend to get off on tangents and be all over the place sometimes. So, but you guys are here for it, and I appreciate that. So let's talk about it. So there are some myths when it comes to heart disease. And one of the myths is heart disease is only an older person problem. Like only old people have this problem. That reality is heart disease is becoming more frequent and more prevalent in younger adults and even teenagers, as I talked about, again, due to lifestyle factors, genetic conditions, and also underlying health problems. And so, as I mentioned, we're seeing heart disease at a higher rate in younger individuals. Individuals in their teens walking around with blood pressures that are elevated, in their teens with enlarged heart because of prolonged history, undiagnosed history of hypertension that's causing their heart to grow and beat more or harder or faster or longer, prolonged, putting extra stress on the heart is what I meant to say. So what are the things where are the places that we can impact or we can reach the younger individuals, in which I love this. Social media is one of the places, right? And then word of mouth. But right now, social media is a place where we can capture the attention of the younger adult and the teenage population. And so looking at the different trends, the viral fitness trends, the fad diets, misinformation can shape or harm the heart. And so it's important that we're putting out the positive information, the correct information, the science-based health stuff that they're going to listen to, and in a way and in a manner that it captures their attention. So we can use these platforms like Instagram, TikTok, for those who are on Facebook, Twitter, some of the other ones, I can't remember. Snapchat are all ways that we can use as healthcare providers, even as parents and those who have influence in these individuals' lives, to get the information out there and to be advocates for them, and also to teach them to be advocates for themselves. So understanding heart disease in the young adult is very similar to that of the older middle-aged population. It's the same. It's just a matter of how do we reach this population. So one of the things that we experience with anyone, but tonight we're focusing on the young adult, is high blood pressure. And as we know, hypertension or high blood pressure is a silent killer. There's usually no symptoms until it's almost too late. And then there's been some end stage target organ damage, meaning the heart, the kidneys, those organs have been severely damaged or have sustained some damage because of the blood pressure that has gone, high blood pressure that's gone undiagnosed. So again, some of the signs and symptoms is dizziness, headache, blurred vision, chest pain in some cases. However, many times there are no signs at all. 1 in 7 young adults between the ages of 20 and 39 in the United States, according to the CDC, which is the Center of Disease and Disease Control Centers, is 1 in 7 between the ages of 20 and 39. And when we look at younger individuals, the numbers are about the same, those that are under 20. I don't know if I shared here, but my nephew, and I'm sure my sister will be okay with me sharing it. I think I shared it here before, and I think I did get her permission to talk about it. My nephew, I believe he was 17 at the time, had a heart attack. At 17 years old, had a myocardial infarction and is dealing with high blood pressure that he will likely have to take medication for the rest of his life. And otherwise, young, healthy individual playing football, very active in sports, has this episode and is being rushed to the hospital and being diagnosed as having a heart attack at such a very young age. And that, what we're thinking, is more so genetics. Nothing else, genetics. Are there any other things that he was doing could have precipitated that or caused this heart attack? Of course, there are some things that he could have been doing, but we don't know all of those details. But just the fact that a 17-year-old, otherwise healthy, has a heart attack. Thank goodness it was caught in time. He was evaluated, he was put on some medication and is being treated and watched, is a miracle in and of itself. When we think about Damar Hamlin and the sudden cardiac arrest that happened with him, it was likely an arrhythmia or irregular heartbeat, just the myriad of things that happened all at once. An irregular heartbeat, he got hit really hard, he dropped, his heart stopped. His heart probably had already stopped before he hit the ground. But the fact that they were able to respond quickly, that they were able to get the AED on board, CPR, whatever life-saving measures that they put into place to help him, was quick and life-saving. Many times the sudden cardiac arrest and the arrhythmias is what we call it, or irregular heartbeat. It's common in athletes, young adults with underlying heart conditions, which is so important. And one of the reasons why they put this criteria into place, where anyone who's going to play high school sports, college sports, even pro sports, have to go rigorous physical exams and cardiac evaluations. Now in Central Florida, and I believe it's the case in many other states and different school zones and that nature, where they have to have an ECG or EKG done, which looks at the electrical part of the heart that lets us know if there's anything underlying. The issue with that is the EKG looks at current, and if there was an episode or something that had happened to the heart previously, it will pick up a heart disease or a heart attack that has happened in the past. But many times it doesn't pick up on the electrical issues that may not be happening at the moment. And so it's important that we educate, and that we ensure that our young athletes and young adults know the signs and symptoms and what to look for. So what are some of the signs and symptoms of sudden cardiac arrest? Maybe there's no signs and symptoms, but when it comes to arrhythmia, fainting or near fainting, heart palpitations where you feel like your heartbeat has changed, where it may speed up really quickly and then go back to a regular rhythm, or it'll be beating regularly and skip a beat. Shortness of breath during exercise, and then sudden collapse in the cardiac arrest. Again, it's sudden and there are usually no symptoms. Or there may be symptoms, but the individual is not contributing it to heart issues. Maybe they're pushing themselves, they're really doing some strenuous exercise and they're experiencing some shortness of breath and dizziness, but they don't contribute it to anything related to the heart. Sudden cardiac arrest is a leading cause of death in young adults when it comes to athletes, and that's according to the American Heart Association. And it's so important that we educate as parents, that we know and we are paying attention to our children and our young adults. I know for me, having had a high school, she was athlete from the time she was in middle school, playing volleyball primarily was her sport. we had to make sure that she was getting those physical exams. And I would talk to her and ask her questions about how she was feeling and things of that nature. And as we moved on to high school, and then when she went away to college, as a parent, I put my trust in the athletic trainer and the coaches to be able to pick up on and to monitor what was going on. And if there was anything that was abnormal happening, then we needed to make sure that she was getting the care that she needed. The next thing that we're going to talk about is myocarditis, and that's inflammation of the heart. So it's inflammation of the heart muscle, just like you were to get a bug bite and it were to get inflamed and red or whatnot. The heart can become inflamed. If you were to sprain a muscle, that area swells and it becomes inflamed. And that can be due to many different things, but mostly myocarditis is related to a viral infection. So typically after a cold, any type of viral infection, COVID-19, or the flu. When I had COVID, and I'm not considered a young adult, I'm a mature adult. How about that? After I had COVID, I developed post-COVID cardiac syndrome, which included myocarditis. My heart muscle had become inflamed, and I had the shortness of breath. I was very tired. I had the flu-like symptoms and just did not know what was going on. And it was weeks, maybe about 2 weeks after I had tested positive and completed all of the signs and symptoms, the major signs and symptoms of COVID. And I believe this was about 2 years ago. And I did not have chest pain, but I could literally not get up and walk from my room to my family room without being really short of breath. So signs and symptoms are chest pain, fatigue, shortness of breath, flu-like symptoms. And again, if an individual has had a viral infection, mononucleosis, COVID-19, the flu, the human pneumometavirus, and they begin to experience these symptoms after that, one of the things we want to look at and make sure is that it's not an inflammation of the heart muscle or myocarditis. The next thing we want to talk about is atherosclerosis, or early onset heart disease and high cholesterol. It is so important that our young adults and even teens are getting blood work. I can remember when my children were younger and we would take them to the pediatrician. At a certain point, I started asking for blood work. And I was told in the literature, it's not something that we do at this age, but if parents request, we can. I wanted to know, one, because we have a family history of certain things, and I want to make sure that we're screening for that. And so I had to ask for it. It was not a given with their physical exam. Certain other things that I requested as a parent, because again, I'm a healthcare provider and I'm in the know of some things, but I wanted to make sure that we were on top of things, and that if there was anything abnormal, that we were working on changing the diet, doing all the things that we needed to. So what is atherosclerosis? Atherosclerosis is a buildup of plaque in the arteries that leads to heart attack at a young age. And it's because the plaque in the artery is blocking the blood flow to the heart, which then causes death to that tissue. Ischemia, which is essentially lack of blood flow, which can lead to blood flow and oxygen, which can lead to death of that heart muscle, and we don't want that. And so what are some of the causes of that? One, poor diet, smoking, vaping, obesity, and high cholesterol, which obesity and high cholesterol can be genetic. It could be have a family history of this, which puts them at a higher rate or higher risk for developing atherosclerosis. So what are the signs and symptoms? Many times there are no signs and symptoms until there is, and that's when the individual is in the active phase of having a heart attack. There's going to be chest pain. There could be shortness of breath, being really tired. And so we need to make sure that we are aware. Again, just like when we talk about some of the respiratory issues, a lot of the symptoms of heart disease are similar in different categories. So just like with myocarditis, there's chest pain, fatigue, and shortness of breath. The same thing holds true with a heart attack. The same thing holds true for atherosclerosis. So knowing the signs and symptoms and knowing their bodies is going to be very important for them. When we talk about statistics, 1 in 3 American young adults between between the ages of 18 and 39 have high cholesterol. 1 in 3. That's a lot. If we have a classroom of 30 young adults or teenagers, and we count off every third, that's 10 people in that group have high cholesterol. And it's related to things that we can change. So things that we can do to prevent it. One leads me right into my next caveat when we're talking about health and wellness is prevention, a healthy diet. So making sure we're getting more fruits, veggies, the lean proteins, the whole grains, the healthy fats, avoiding the ultra processed foods, the high sugar drinks, and excessive sodium is going to help. It's going to help decrease the blood pressure. It's going to help to make sure that if there is an issue with high cholesterol, that we're seeing those numbers decrease. Increasing exercise is going to be the case. You guys already know 30 minutes, 5 times a day of moderate intensity exercise, walking, running, jogging, sports is going to help. Managing mental health. Let me go back. Strength training is also going to help. The more muscle we're building, you're decreasing the adipose tissue or the fat that's around those muscles, and it's going to help also decrease decrease their chances of developing diabetes, because fat tends to store the glucose, which can increase the individual glucose, and there's more increase in cortisol levels and all of that. And so once we begin to decrease the adipose tissue or that excessive fat, then we will begin to see numbers decrease. The cholesterol numbers going down, the blood pressure going down, the glucose levels, and the A1C numbers going down. So strength training for muscle and heart health. Doing some cardio, things of that nature that's going to train the heart muscle. Stress it out to enough to where it can begin to adapt to the exercise, and you're getting more anaerobic exercise where you're getting more oxygen and you're really turning over the blood flow as you're exercising. The next thing is mental health and stress. So high stress levels can lead to heart disease. We already know that. Increase the blood pressure, things of that nature. So mindfulness, therapy, work-life balance is going to help in protecting the heart. I can tell you this generation, they're going to get it. They have it together when it comes to work-life balance. Sometimes it's an imbalance of that, but they will put themselves first when it comes to. Many of them are not going to let people stress them out. They're not going to let a job stress them out. They're going to disconnect themselves and go and do something else. And so for that, I commend them, but we have to have a healthy balance when it comes to that. Next thing is something that's really popular among young adults and teens is smoking and vaping. Nicotine increases the heart rate and blood pressure, increasing heart disease at an even earlier age. And this is where we're seeing the teenagers and the young adults, the adolescents who are essentially addicted to vaping, not realizing what it is they're putting in their body and how it's impacting, and it's causing lifelong adverse health impacts. Their heart is being damaged, their lungs are being damaged, and we got to do something to change that. So we have to educate, advocate against the use of vaping and smoking, as not just tobacco. We're not seeing cigarette smokes or tobacco smoke in the younger adults as we used to, but we're seeing more vaping and marijuana use. So it's important that we have those conversations early and that we're trying to ensure that they are impactful and changing those behaviors. So what can we swap? What can we switch out? Instead of vaping, what can we change? Another treatment is in terms of treatment for hypertension is lifestyle changes first before we put them on medication. And if the lifestyle changes are not helping, changing the diet, increasing the exercise, getting more active, if those aren't making any positive changes, then we're going to need to look at medication in those populations. With myocarditis, one of the biggest things is rest and medical monitoring. So usually those individuals are going to be followed up with a cardiologist. If they go into the ER with these issues, they're going to be seen by cardiology and typically followed for a couple months or some months after. to ensure that the inflammation has decreased, that there has not been any permanent damage to that heart muscle, and that they're returning back to baseline. When it comes to arrhythmias and cardiac arrest risk, beta blockers, which is a type of medication that helps with the heart rate, as well as implantable devices such as AED or defibrillators or pacemakers if it's due to an irregular heartbeat. And then surgery in severe cases if there's any abnormalities or structural issues. Even if there's a electrical issue within the heart, there's something called a cardiac ablation where they can go in and kind of ablate those areas that may be causing those extra beats. I am not a cardiology specialist when it comes to my specialist family, but I do have some knowledge based on personal history and just, having consulted many cardiologists related to patients that I've seen. So I want to put that out there. I'm not a cardiac specialist, but I do have some knowledge. And also high cholesterol and atherosclerosis, diet, exercise, and then cholesterol lowering medication. One of the things with cholesterol lowering medication is that some individuals can't tolerate them. Some may have extreme muscle cramping or pain, things of that nature, and that's not something that we can place them on. But there's many different options. As you know, I love natural things first. Things that we can do to change those things is important. Want to make sure that you all are knowledgeable, that you have the information that you need, that we are educating, that we are aware. And I want to make sure that those who are watching share this information with your family or your community or your friend groups who may have young adults or adolescents who may not be aware of this information. Tag a friend, share this message. Heart health starts now. And it's not just the older individuals who are dealing with this. We're seeing our younger individuals who are being diagnosed with heart conditions, diabetes, high blood pressure, all of that, and it's impacting their heart. And if they're being diagnosed at such a young age, it's cutting off years of their life. They're going to be faced with more health challenges as they get older if we don't reverse it, or if we don't change the pattern and the path in which they're going, or the pattern of their health care. And so your heart is your most important muscle. Yes, we can go in and build up our muscle, but we want to make sure that we're taking care of it. And one thing that I want to put in there, stay away from the sports drinks, and not the sports drinks, but the energy drinks. They're not good for you. Not all energy drinks are created equal, and not all energy drinks are bad. I want to put that out there. So do your research. But the Monsters and all of those things, it's been proven that they're not good for your health. And so if you have to take an energy drink, if you're working out and you need that extra boost, look for some more healthier ones that are more plant-based and with natural ingredients. I would caution younger individuals from taking and drinking energy drinks. Sleep and rest and proper nutrition is going to be the way to go. Sleep hygiene. If you're having trouble or you're getting to bed later, maybe you sleep longer the next day. But let's do what we need to do to take care of our health. Your heart is your most important muscle. Protect it today for a longer, healthier life. This is Dr. Latoya Wells with Wells Legacy Health and Wellness. Exciting announcement. We have gotten some insurance approvals to be able to accept certain insurances. I will be posting that later. But if you would like to know if we accept your insurance, if you're looking for a new primary care provider, we are accepting new patients. Reach out to us. You can check us out on the web at wellslegacyhealth.com. You can give us a call at 321-306-6755. We offer early morning, evening, and weekend appointments. So flexibility, convenience for you. We offer multiple different modes of appointments. So exciting to be able to reach you in different ways. We're looking forward to meeting you. We're looking forward to taking care of you and partnering with you in your health journey. Stay safe and be well. This is Dr. Latoya Wells with Wells Legacy Health and Wellness. Until next time, bye.